If you are amongst the fortunate majority who only suffer headaches every so often, you will probably have gathered by now that for those who are less fortunate that suffer headaches on a regular or persistent basis, seeking medical attention is often necessary. Although irregular headache sufferers would probably never consider doing anything more than taking an over-the-counter painkiller to get rid of their headache, for those who suffer the worst ravages of primary headaches, as highlighted over the previous few chapters, self-medicating with painkillers in this way is not always a viable option. Consequently, I'm going to consider and highlight many of the medical treatments that your doctor may prescribe if you are a persistent or regular headache sufferer, whilst also pointing out some of the potential side effects of those drugs that you should be aware of.
Medical treatments for tension-type headaches. If you are a person who only suffers headaches every now and then you are more than likely an episodic tension-type headache sufferer. In this case, most sufferers are likely to turn to an over-the-counter analgesic painkiller to treat their condition. We will consider the various different forms of analgesics towards the end of this chapter, because you might be surprised at some of the potential side effects of even these apparently benign drugs. For chronic tension-type headache sufferers, there are many different types of drugs prescribed, which will be known by a wide variety of brand names. Amitriptyline. This drug goes under a huge range of different brand names, and although it was originally used as an antidepressant, it is nowadays often prescribed for people who suffer chronic tension-type headaches or migraine, albeit in relatively small doses. Some of the less pleasant side effects suffered by some users are weight gain, nausea, constipation, dizziness, dry mouth, blurred vision, and insomnia. In more serious cases, the drug has been seen to cause hypotension, psychosis, arrhythmias, heart blockage, and depression.
It's important to be aware of these potential side effects, especially if you're considering this medication. Always discuss with your doctor to ensure it's the right choice for you.
Mirtazapine. Mirtazapine, known as Remeron in the USA, Canada, Australia, and South Africa, but as Zispin or Zispin Soltab in the UK and Ireland, is a psychoactive drug that is primarily used as an antidepressant. In addition to being used as an antidepressant, it has also been found to be effective in the treatment of migraine and chronic tension-type headaches. Although, once again, it is a drug with a long list of potential adverse side effects attached to it. The common side effects include blurred vision, dizziness, sedation, increased appetite and accompanying weight gain, shallow breathing or hypoventilation, malaise, decreased body temperature, restless leg syndrome, and many, many more. More seriously, side effects may include convulsions or seizures, excessive water retention and edemas, nausea and vomiting, diarrhea, sexual dysfunction, and depression or anxiety that can, in the most serious cases, border on suicidal behavior. In addition, the drug has also caused mild to moderate psychedelic experiences and effects in some patients, although whether everyone would necessarily agree that this is an adverse side effect is open to debate. Sodium valproate. Some doctors may consider using sodium valproate as a prophylaxis, that is, a drug that is designed to prevent chronic tension-type headaches rather than get rid of them. The main use of sodium valproate is as an anti-epileptic drug, with the main downside of this particular drug being that the chances of a baby being born with a birth defect to anyone taking this particular drug are somewhere between 2 and 5 times higher than they are with other anti-epileptic drugs. Furthermore, there is some evidence that children born to a mother who is taking a valproate drug have a significantly higher chance of suffering autism as well, according to a study carried out in 2005 by the Autism Association of America.
Medicines for migraine. As suggested in the previous chapter, Both of the main prescription drugs that your doctor is likely to prescribe for dealing with chronic tension-type headaches are also often prescribed for combating the worst effects of migraine as well. Some doctors may also consider prescribing sodium valproate as well as a prophylactic to prevent the onset of migraine headaches before they start. There are, however, some different forms of treatments that might be prescribed to deal with migraine headaches, with the first line of attack generally being over-the-counter analgesics like aspirin, Tylenol, and paracetamol, which is acetaminophen in North America. If the individual suffering from a migraine headache is fortunate enough for it to be only a mild attack, such analgesics will probably be strong enough to deal with the problem, although whether you want to take analgesics is another matter entirely, for reasons highlighted later. Sometimes these analgesics will be taken or rendered entirely on their own, whereas at other times it might be prescribed or taken in combination with other substances, such as caffeine. Whilst migraine sufferers are generally advised to limit their caffeine intake, it does seem that combining analgesics with caffeine enhances the effectiveness of the drug, and caffeine is itself recognized as an over-the-counter drug by the FDA. As suggested earlier, migraine headaches are often accompanied by nausea and/or vomiting, so it is not uncommon for the analgesics rendered to be combined with antiemetic drugs as well. For migraines that do not respond to over-the-counter drugs or other analgesics, your doctor may prescribe a serotonin-specific reuptake inhibitors, SSRIs, which are effective for getting rid of mild to moderate migraine headaches that do not respond to analgesics or other first-line drug defenses. Although SSRIs are not approved by the FDA for the treatment of migraine headaches, tests and trials have indicated that they can help in certain circumstances. Technically speaking, the primary usage of SSRIs is as an antidepressant drug, and once again, there is a long list of potential adverse side effects which you might suffer if you choose to take one of these drugs to deal with your migraine problem. These side effects include apathy, nausea and vomiting, drowsiness, dizziness, changes in appetite and sleep patterns, tremors, and weight loss or weight gain. Most of these side effects are felt soon after starting to take the drugs as your body gets used to them, and many of them will pass. However, it is also known for SSRIs to cause far more serious side effects, with some patients reporting sexual problems and cardiovascular side effects. Furthermore, because they are antidepressant drugs, SSRIs can create a degree of dependency in any patient who takes them for anything other than the shortest period of time.
Perhaps you might think that because they are openly sold in pharmacies and drugstores with government approval, that all over-the-counter analgesics must be safe. But this is an assumption that you should not allow yourself to make. Despite the fact that drugs sold in most Western countries have to be government approved, the fact that they are should never be taken as proving that they are completely safe, because even the most common or garden analgesics do have potential side effects. For example, although it has been on open sale for more than 100 years, the humble aspirin does have acknowledged adverse side effects in some people, including stomach ulcers and gastrointestinal bleeding. Large doses of salicylate, which is a metabolite of aspirin, have been shown to cause tinnitus in rats, and it is not at all uncommon for people who take aspirin reasonably regularly to develop swelling and hives. In a worst-case scenario, it is also known that aspirin can cause a little-known condition known as Reyes syndrome in children, which can cause serious damage to the brain and liver, and might ultimately prove fatal.
If you are taking paracetamol, which is acetaminophen, there is a long list of possible side effects attached to the drug, even though it is highly effective as a painkiller, especially when paired with other painkillers such as codeine, as it often is in over-the-counter medicines. Nevertheless, taken in large doses, paracetamol can cause liver failure and ultimately death. It is the #1 cause of acute liver failure in both the USA and the UK. But even at regular dosage levels, the same results can occur in some unfortunate people. Furthermore, excessive use of paracetamol might cause serious damage to other internal organs, while some studies have indicated that the drug can cause internal bleeding in even relatively small dosages too. The bottom line is, even apparently safe and benign over-the-counter analgesics are not necessarily as safe as you might imagine them to be, with plenty of nasty potential side effects. As suggested, this might give you cause to reconsider whether using chemical-based analgesics is such a good idea after all.